Most people think sciatica is just a nerve problem, a pinched nerve, maybe a slipped disc. And while those things can absolutely be part of the picture, they're not the whole story. What's often missed is that sciatica and chronic back pain are usually symptoms of something deeper. A breakdown in how your body handles inflammation, muscle recovery, and mechanical stress, which means they're not just problems in your spine. They're problems in your system. And here's the good news. Your body is incredibly capable of healing itself. But it can't do that if you keep chasing surface-level solutions while ignoring the underlying stress patterns, nutrient deficiencies, and muscle imbalances that are driving the pain in the first place. Pain is not your enemy. It's your body's way of communicating with you, of asking you to listen. Now, for anyone over 50 or 60, this kind of pain becomes even more common, and not just because of wear and tear. The real reason is that recovery slows down. Muscle tissue becomes less elastic. Inflammation becomes more persistent. And small imbalances, ones your body could easily compensate for in your 30s, now create a ripple effect that leads to shooting nerve pain, numbness, and stiffness that won't go away. And that's where most mainstream advice falls short. You'll be told to take painkillers, stretch, or maybe try injections, but you won't be told how to support the body's actual repair systems. You won't be told how to feed the muscles that protect your spine, or how nutrient timing, mitochondrial energy, or magnesium deficiency can directly affect your ability to heal. And that's what this video is here to change, which means in the next few, you're going to learn what's really happening in your body when sciatica flares up and how to stop it naturally by working with your physiology, not against it. Discover the nutrients and habits that calm inflammation at the root, the sleep cycles that actually repair nerve tissue, and simple movements that realign the body without strain or pressure. We'll also cover how your gut hydration and stress hormones play into back pain, because healing isn't just physical, it's systemic. So if you've been told that sciatica is just something you have to live with, or that surgery or injections are your only options, I want to offer you something different. A map back to how your body is designed to function and how you can begin to support it today. If you care about sleeping deeper, healing faster, and aging with energy, make sure to watch until the end and subscribe so you don't miss the natural wisdom your body is craving. When most people think of sciatica, they think of a pinched nerve, maybe a bulging disc, something mechanical that needs to be physically pushed back into place. That's how it's usually explained, and why the most common solutions involve surgery, injections, or stretches designed to release the nerve. But what if the real problem isn't just compression? What if the real reason that nerve is screaming is inflammation? This is something I want you to really consider, because what's happening in your body when you're experiencing sciatica, the shooting pain down your leg, the burning in your hip, the tingling in your foot, is often not caused by a physical pinch at all. In many cases, there's no structural damage visible on scans, no herniated disc, no spinal fracture, just pain, persistent, sometimes debilitating pain. And that pain, in many cases, is being driven by systemic, low-grade inflammation. Here's how it works. When your body is in an inflamed state, whether from diet, stress, poor sleep, or chronic muscle tension, your nervous system becomes hypersensitive. The nerve endings around your spine, hips, and legs are surrounded by immune cells. And when those immune cells are constantly being activated, they release inflammatory chemicals that make your nerves more reactive. They don't need to be compressed to fire pain signals. They just need to be irritated. This is especially true of the sciatic nerve, which is the longest and thickest nerve in the body. It runs from your lower back all the way down each leg, and it's surrounded by tissue, muscles, fascia, joints that are all susceptible to inflammation. So when inflammation becomes chronic, that entire environment becomes a pressure cooker. The nerve doesn't stand a chance. Now, inflammation isn't the villain. Your body uses it to heal. But when it's stuck in that mode, which means when the signal to cool down never arrives, inflammation turns from helpful to harmful. It becomes self-perpetuating, and it keeps your nerves in a constant state of tension, even when you're doing everything right on the outside. This is why traditional treatments often fall short. You can stretch, you can ice, you can adjust your spine, but if the internal chemistry of your body is telling your nerves to stay irritated, those mechanical treatments may only give you temporary relief, if any. So what can you do? The answer starts with calming the inflammation, not just where the pain is, but where it's coming from. One of the fastest ways to lower systemic inflammation is by controlling insulin. Every time your blood sugar spikes, your body produces insulin, and chronically elevated insulin is a powerful inflammatory driver. So when you switch to a lower carb, nutrient-dense diet, even for a few days, you can see a dramatic drop in pain. Omega-3 fatty acids also play a role. Most people over 60 are getting too many omega-6 oils from processed foods, not enough anti-inflammatory omega-3s from foods like wild sardines or flaxseed. When you rebalance these fats, your cell membranes become less reactive, and the entire nervous system becomes less trigger happy. Magnesium is another overlooked factor. Without enough of it, your muscles tighten, Your stress response stays elevated, and your nerves don't get the calming signal they need to recover. Adding magnesium-rich foods like spinach, pumpkin seeds, and almonds can be one of the simplest ways to begin soothing that inflammatory cycle. Hydration matters too. Inflammation thickens your blood and reduces nutrient delivery. Most people dealing with chronic pain are mildly dehydrated, not just in terms of water intake, but also mineral balance. Adding a pinch of sea salt and a squeeze of lemon to your water once or twice a day can help rehydrate your tissues at the cellular level, which supports circulation and recovery. But perhaps most importantly, you need to sleep. Deep sleep is when your body shuts down that inflammatory signaling and starts repairing damaged nerve tissue. If you're waking up in pain or tossing all night, it's not just discomfort. It's your body telling you the healing process isn't completing. We'll cover more on sleep later, but for now, just understand this: without sleep, you're stuck in the inflammation loop. So when someone tells you sciatica is just a mechanical issue, know that they're only seeing part of the picture. Pain is a complex signal, and often the fastest way to stop it isn't push or pull on the nerve. It's to cool the system down from the inside. If this is helping you see sciatica in a new light, tap the like button. It helps us reach others who are still stuck in the pain cycle. And if you haven't subscribed yet, now's a good time, because we're about to go deeper into what your muscles are trying to tell you and why magnesium might just be the missing link in your recovery. Let's talk about something that almost never gets mentioned when it comes to sciatica or back pain, and that's magnesium. Not stretching, not surgery, not painkillers. Magnesium, because what's often overlooked is that sciatica isn't always caused by a compressed nerve. Many times it's caused by a tight muscle that's firing constantly, pulling on the joints, squeezing on soft tissue, and sending signals of pain down your leg or into your back. And one of the biggest reasons that muscle won't relax is because your body is low in magnesium. Magnesium is what allows your muscles to let go. Without it, they stay contracted chronically. That includes muscles like the piriformis, a small but powerful muscle deep in your glute. It sits right on top of the sciatic nerve, and when it tightens up, which is very common, it can press on that nerve like a vise. This is called piriformis syndrome, and it often mimics classic sciatica. Same burning sensation, electric shooting pain. But instead of a disc problem, it's a muscle problem made worse by a biochemical imbalance. Here's how it works inside the body. Every time a muscle contracts, calcium floods into the muscle cell. And to relax that muscle, magnesium has to push the calcium back out. That's the balance. Calcium tightens, magnesium loosens. But when magnesium is low, the calcium stays stuck, and so does the tension. Now here's the challenge. As we age, our magnesium reserves naturally decline. We also tend to absorb less of it from our food. Add stress, poor sleep, or certain medications like diuretics or antacids, and that depletion accelerates. So even if you're eating well, it's very possible that your muscles are starving for magnesium. And you can feel it in the form of leg cramps, restless legs, eye twitches, stiff lower back, and yes, persistent hip or sciatic pain that flares up, especially after sitting or sleeping. So what's the solution? Start by replenishing what's missing. Eat more magnesium-rich foods like spinach, pumpkin seeds, almonds, avocados, and even a small square of dark chocolate. These don't just taste good. They send a biochemical signal to your nervous system to unwind. You can also consider topical magnesium, like magnesium chloride oil or Epsom salt baths. When applied to the skin or absorbed through a warm soak, magnesium bypasses the digestive system and goes straight to the tissues, where it's needed most. And if you supplement, go for a form that's well absorbed and calming, like magnesium glycinate. It's gentle on the stomach and supports the parasympathetic nervous system, the part of your brain and body responsible for rest, digestion, and healing. Now, none of this is about treating symptoms. It's about restoring normal function, because your body wants to heal. Your muscles don't want to stay tight, which means your nervous system doesn't want to stay in fight or flight mode. It just needs the right tools to shift gears, and magnesium is one of those tools. I often tell my clients, which means you don't need to fight your body, you just need to understand what it's asking for. And here's something you may not realizing: magnesium also helps regulate serotonin and GABA, two neurotransmitters that control pain perception. When your magnesium levels improve, not only do your muscles relax, your brain interprets pain differently. What felt sharp and severe can begin to feel more distant, more manageable, sometimes within days. And of course, better magnesium means better sleep, and better sleep means more recovery, especially in tissues like fascia and nerve sheaths, which don't heal well during the day when cortisol is high. So if you've been stretching and doing everything right, but your pain keeps returning, look at what's happening inside your body. Are your muscles getting the minerals they need to recover? Are you getting the nutrients that turn off the pain loop? Because sometimes the key to stopping sciatica isn't pushing harder, which means it's feeding your body the missing pieces that let it finally let go. If this is helping you see your pain from a new angle, hit that like button. It helps us reach more people looking for real healing, which means not just temporary fixes. And subscribe if you're learning something new, because in the next section, we're going to talk about energy, not the kind you feel in the afternoon, but the kind your cells use to heal, especially your mitochondria, the repair engines behind long-term relief. When it comes to sciatica and chronic back pain, we often think in terms of joints, muscles, and nerves, but healing doesn't begin in your spine. It begins inside your cells. At the core of every muscle fiber, every nerve sheath, and every ligament in your back is a tiny structure called the mitochondrion. You can think of it as your body's battery pack. It's where your cells produce ATP, which is the energy they use to grow, repair, and function properly. Now here's the problem: as we get older, especially past 50 or 60, those mitochondria don't work as well. They become sluggish. They produce less ATP, that means your body has less energy to repair itself, even if you're doing all the right things. This is one of the biggest reasons recovery slows down with age. It's not just the tissues are older, it's because the energy behind the repair process has weakened. And for the spine, this is especially important. The structures in your lower back and hips, the discs, the small stabilizing muscle, the fascia, all have a relatively low blood supply. That means they're already at a disadvantage when it comes to getting nutrients and oxygen. And when you add in low cellular energy, it becomes very hard for those tissues to fully recover after strain, inflammation, or injury. So what does that mean for you? It means that if you want to stop recurring sciatica or long-standing back pain, you can't just look at muscles and nerves. You need to recharge the system that powers their recovery. And that starts with your mitochondria. Let's talk about how. First, mitochondria thrive on movement, especially low-intensity, consistent movement like walking, stretching, and slow resistance training. These don't just strengthen your muscles. They tell your cells we need more energy. We need to adapt. And in response, the body creates more mitochondria. It's called mitochondrial biogenesis, and it's one of the most powerful anti-aging tools we have. Second, mitochondria are highly sensitive to oxidative stress. This is when too many free radicals build up and start damaging your cells. Things like processed foods, poor sleep, chronic stress, and sedentary behavior accelerate oxidative damage. But antioxidants, especially those found in real whole foods, help buffer that damage and protect your cellular engine. Some of the best mitochondria supporting nutrients include CoQ10, lipoic acid, vitamin C, B vitamins, and carnitine. These aren't just supplements. These are essential building blocks for energy production. You can support these nutrients through food. Grass-fed beef, pasture-raised eggs, salmon, spinach, beets, and dark berries are all rich in the compounds your mitochondria need. These foods don't just nourish your body, they turn on your body's ability to heal. Hydration also matters here. Dehydrated cells are low-performing cells. And as we age, our thirst response weakens, meaning many older adults are walking around chronically underhydrated, which reduces oxygen transport, nutrient delivery, and cellular waste removal. That's a triple hit to your mitochondria. One simple practice is to start your morning with a glass of water mixed with a pinch of sea salt and a squeeze of lemon. This doesn't just hydrate, it provides trace minerals that help regulate the electrical flow across your cells. Finally, sleep is non-negotiable. Deep sleep is when your body clears mitochondrial waste, balances hormones, and restores cellular energy. If your sleep is broken, shallow, or delayed by blue light and evening stimulation, your cells don't fully recover. And that shows up as pain that lingers longer than it should. The truth is, your mitochondria are like the staff of a repair shop. If they're tired, underfed, or short-staffed, nothing gets fixed. But when you support them with nutrient-dense food, gentle movement, deep sleep, and real hydration, everything starts working again, including the nerves and muscles involved in sciatica. So instead of only treating the symptom, focus on rebuilding the energy behind the repair. That's where long-term relief begins. If this gave you a new insight into how your body actually heals, give the video a like. It helps others discover this kind of holistic guidance, and subscribe if you're on a path to healing through nature, not just medication. Because in the next section, we'll explore how your gut plays an unexpected role in nerve pain, inflammation, and spinal health. When you're dealing with back pain or sciatica, the last thing most people think about is their gut. It seems unrelated. After all, how could your digestion possibly affect a nerve in your leg or tension in your lower back? But the more we understand how the body works as a system, not as isolated parts, the more we realize that healing the spine sometimes starts in the gut. Let me explain. Inside your digestive tract lives a vast community of bacteria known as your gut microbiome. These microbes do much more than help digest food. They regulate your immune system, your hormone balance, your mood, and yes, your inflammatory response. When your microbiome is healthy, it produces anti-inflammatory compounds, strengthens the gut barrier, and communicates with your nervous system through what's called gut-brain axis. But when your gut is out of balance, something we call dysbiosis, the communication between your gut and your brain becomes distorted. Your immune system becomes overactive, inflammation increases, and pain signaling becomes amplified. Here's how that matters for sciatica and back pain. When your gut lining becomes too permeable, often called leaky gut, particles from undigested food or harmful bacteria can leak into the bloodstream. Your immune system responds aggressively, thinking it's under attack. This creates systemic inflammation, which travels through your entire body, including the muscles and nerves surrounding your spine. This inflammation doesn't just float in the background. It changes how sensitive your nerves are. It makes your muscles more reactive, and it lowers your threshold for pain, meaning things that wouldn't have hurt before now trigger discomfort or shooting nerve pain. This is why some people experience chronic pain flare-ups after eating certain foods, or why pain seems worse when digestion is off. It's not just a coincidence. It's your internal environment speaking to your nervous system. So how do you begin to repair this connection? Start with food, because food is information for your microbiome. Highly processed foods, excess sugar, alcohol, and refined grains feed the wrong types of bacteria. They throw off microbial diversity and increase gut permeability. But real whole foods, especially fermented vegetables, bone broth, ginger, garlic, leafy greens, and berries, support healthy gut flora and reduce inflammation from the inside out. One of the most powerful shifts you can make is to add prebiotic fiber to your meals. This doesn't come in a pill. It comes from things like asparagus, onions, leeks, artichokes, and flax seeds. These fibers feed the beneficial bacteria that help regulate your immune system and reduce pain signaling. You can also support your gut by avoiding eating too late at night, giving your digestive system time to rest and recover. A 12 to 14-hour window between dinner and breakfast can do more for your gut than most people realize, and it's a natural way to reset your inflammation cycle. Another layer is stress. Chronic stress alters the balance of your gut bacteria and increases cortisol, which means your gut lining and suppresses immune regulation. So managing stress isn't just good for your mind, it's good for your spine. Simple things like breathwork before meals, walking after you eat, or practicing gratitude in the evening can improve vagus nerve tone, which directly links your gut to your brain and your pain regulation system. It means it's all connected. And if you've been treating back pain with only physical methods, stretches, posture correction, or massage, but still feel stuck, this might be the missing piece. Your gut influences how inflamed your body is. It affects how sensitive your nerves are, and it can be the hidden source of pain that no scan or X-ray will ever show you. If this is opening your eyes to how powerful your gut really is, hit the like button. If you haven't already, subscribe, because the next segment will bring it back to something more familiar: movement. We'll break down why posture and everyday movement habits may be quietly feeding your pain cycle, and how to reverse that naturally. One of the most common things I hear from people in pain is, "I didn't do anything. It just started. No fall, no injury, no big moment. Just pain, sudden, sharp, often shooting down the leg." And while it feels like it came out of nowhere, the truth is, most cases of sciatica and back pain are the result of micro-trauma. Not one event, but 1,000 small moments that quietly add up over time. Let me show you what I mean. Every time you sit in a slouch position, your lower back rounds, your pelvis tilts, and your spine takes on more pressure. Now do that for an hour, or 4, or every day for years. Over time, that tension accumulates in the small stabilizing muscles around your spine, hips, and pelvis. These muscles, the glutes, the deep core, the hip flexors, are designed to share the load. But when they become weak or imbalanced, other muscles take over. Your lower back starts doing the work your glutes should be doing. Your hamstrings tighten to compensate for a weak core. Your piriformis overfires to protect an unstable pelvis. And the sciatic nerve, it gets caught in the middle of all this dysfunction. This doesn't happen overnight. It happens slowly, sitting too long, standing with one hip cocked, walking with uneven stride lengths, even how you get in and out of the car. These micro movements, when repeated with poor posture, create friction, inflammation, and eventually pain. The good news is that your body adapts just as well to good patterns as it does to bad ones. Once you give it the right signals, you don't need to become an athlete to fix this. You just need to wake up the muscles that were designed to protect your spine and take pressure off the ones that are overworking. Start by becoming aware of your daily posture. When you sit, imagine lengthening your spine as if a string is gently pulling the top of your head upward. When you walk, focus on evenly distributing your weight between both legs. And when you stand, engage your glutes slightly and avoid locking your knees. These simple shifts reduce strain on your lower back and begin retraining your neuromuscular system. Next, activate your glutes. Most people with sciatica have weak gluteal muscles, not because they're lazy, but because those muscles have been shut off from years of sitting. A few minutes a day of intentional glute work, like bridges, standing leg lifts, or controlled squats, can take enormous pressure off your spine. Another area to look at is your psoas, a deep hip flexor that connects your spine to your legs. When it gets too tight, it compresses the lumbar spine and throws off pelvic alignment. Gentle stretches like lunges with a posterior tilt or supported psoas releases can help open this space and restore balance. But even more important than stretching or strengthening is how you move throughout your day. Are you bracing when you stand up? Are you twisting awkwardly when you reach? Are you holding your breath when you bend over? Breath, by the way, is a key part of spinal health. Breathing deeply through your diaphragm helps stabilize your core and regulate your nervous system. It's one of the simplest ways to create safety in the body, and safety is what turns down the pain signals. Because remember, your body doesn't just respond to damage. It responds to threat. And poor movement patterns, even if subtle, are interpreted by your nervous system as a threat. That's what keeps muscles locked, joints inflamed, and nerves irritated. When you move with awareness, when you teach your body that it's safe and stable, your pain response begins to quiet down. So no, the pain probably didn't come out of nowhere, but the healing doesn't have to take forever either. Just like poor patterns build up over time, good patterns do too. And the moment you shift how you move, you start changing the signals your brain and body send to each other. If this is helping you rethink your posture or your habits, tap the like button. It really helps more people find this content. And make sure to subscribe, because in the next section, we'll explore the final piece of the pain puzzle, sleep, and why, if you're not getting deep, restful sleep, your nerves may never fully heal. Let's talk about the part of healing that most people ignore, or at least underestimate. Sleep, not just getting into bed, not just closing your eyes. I'm talking about deep, uninterrupted, slow-wave sleep. The kind your body uses to repair nerve tissue, reduce inflammation, and regulate pain. Because here's the truth. If you're not sleeping deeply, you're not healing fully. It doesn't matter how well you stretch, how clean your diet is, or what supplements you take. Your nervous system does its real repair work while you sleep. And that repair happens in stages. First in the muscles, then in the fascia, then finally in the nerves themselves. Now here's why this matters for sciatica and chronic back pain. When you sleep, especially in the deeper stages, your body releases growth hormone and activates internal anti-inflammatory mechanisms. Your brain clears out waste products through something called the glymphatic system, which only works while you're deeply asleep. Your muscles stop firing, your blood pressure drops, and your energy gets redirected to cellular regeneration. But if you're tossing, waking up often, or getting light, fragmented sleep, those healing cycles never finish. You wake up stiff, sore, foggy, and the pain that should have calmed overnight is still there, sometimes worse. This is common after 60. Melatonin production goes down. Cortisol stays elevated longer. The brain doesn't transition into deep sleep as easily. But that doesn't mean you're broken. It just means your sleep environment and lifestyle need to support your natural rhythms again. Let's talk about how. First, light is the biggest signal to your sleep cycle. If you're exposed to bright, artificial light at night, especially blue light from phones or TVs, your brain thinks it's still daytime. Melatonin gets suppressed, and the transition into sleep becomes delayed and shallow. Start dimming your lights after sunset. Use warm lighting. Avoid screens 60 to 90 minutes before bed. And in the morning, try to get natural sunlight on your eyes within the first hour of waking. This anchors your circadian rhythm and helps your body know exactly when to rest and when to repair. Next, be careful with meal timing. Eating too close to bedtime keeps your body in digestion mode. That means less energy available for repair. Try to finish your last meal at least 2 to 3 hours before bed. If you need something small, keep it light. A few magnesium-rich almonds or a slice of turkey can actually support sleep rather than disrupt it. Speaking of magnesium, we talked about it earlier for muscle tension, but it's just as powerful for sleep. Magnesium helps activate GABA, a calming neurotransmitter that slows down your brain waves and prepares your body for rest. Magnesium glycinate or magnesium threonate are excellent choices to support both the body and brain in winding down. Now, let's talk about stress. Chronic stress keeps your nervous system in a sympathetic, fight or flight state, even while you're trying to sleep. That's why many people with back pain or sciatica feel more pain at night. The muscles can't fully relax. The nerves stay on high alert. Simple evening rituals like breathwork, gentle stretching, herbal tea, or gratitude journaling can shift you into parasympathetic mode, which is where your body heals. And finally, create a consistent sleep schedule. Going to bed and waking up at the same time each day, even on weekends, trains your brain and hormones to flow in rhythm. And when your rhythm is strong, pain reduces faster, tissue repairs faster, and your body works with you, not against you. So if your pain has plateaued, if you've made all the right changes, but something still isn't clicking, don't overlook your sleep. It may be the missing piece. Because sleep isn't passive, it's where your body does the real work. And when you give yourself the time, the space, and the nutrients to sleep deeply, the healing process accelerates, often without you even realizing it. If this is helping you see healing in a deeper way, give the video a like so others can discover it. And make sure to subscribe, because now that you've got the full picture, inflammation, nutrients, movement, mitochondria, and sleep, we're ready to bring it all together into a simple, daily plan you can start today. If you've made it this far, you now understand something that most people struggling with sciatica and back pain never hear. That pain isn't random, and healing isn't complicated. It's just layered. It's not about chasing symptoms. It's about understanding what your body is trying to tell you and learning how to respond to it wisely, gently, and consistently. Let's take a moment to connect the dots. We started with inflammation, because what most people think is just a pinched nerve is often a hypersensitive, inflamed nervous system. Your sciatic nerve doesn't just react to pressure. It reacts to your entire internal environment, what you eat, how you recover, and whether your nervous system feels safe enough to let go. We looked at magnesium and how a simple mineral deficiency can keep your muscles locked in spasm, especially the small muscles deep in your hips and lower back. When magnesium is low, tension rises. And when tension rises, nerves get trapped. Feeding your muscles what they need can often unlock pain that's been there for years. Then we explored mitochondrial energy, the healing power source inside your cells. You learned that the older we get, the more we need to support our mitochondria to keep repair systems active. That means movement, nutrient-rich foods, and plenty of oxygen and hydration. Not to stimulate, but to restore. We uncovered the gut-spine connection, the idea that your digestion and your pain are linked in ways that are rarely discussed. But once you understand that inflammation starts in the gut and that your microbiome talks directly to your brain and your nerves, you realize that pain relief might begin on your plate, not just on your yoga mat. We talked about posture and microtrauma, the tiny daily movements that build up into chronic dysfunction. Most people don't realize that poor movement patterns send constant stress signals to the brain, and the brain, trying to protect you, tightens everything up. Restoring alignment, even in small ways, starts to break that pattern. And finally, we focused on sleep, the most underestimated healing tool of all, because it's at night that your nervous system turns inward. That inflammation gets cleared, that tissues rebuild. And when sleep is poor, pain lingers, even if you're doing everything else right. So what does this mean for you? It means you're not broken. It means your body still knows what to do. It means healing is not about doing more. It's about creating the conditions that let your body do what it's been trying to do all along. Your body is designed to heal itself. You just need to stop interrupting that process and start supporting it. Let's make it practical. Here's your natural health challenge for the next 72 hours. Start your morning with movement. Nothing complicated. Just 10 minutes of walking or gentle stretching to wake up your circulation and support your mitochondria. At lunch, add something that feeds your nervous system. That could be magnesium-rich spinach, omega-3-rich salmon, or a small serving of fermented vegetables to support your gut. In the evening, finish eating at least 2 hours before bed. Dim your lights, turn off screens, and if possible, take a warm Epsom salt bath to give your body a transdermal dose of magnesium, while signaling your nervous system that it's safe to rest. Then go to bed at the same time for the next 3 nights. Protect that sleep window. Give your body the gift of stillness and see what happens. You may find your pain is a little softer, your steps a little lighter, your recovery a little faster. And if you do, that's your body waking up, responding, healing. If you found this helpful, let us know in the comments. What will you try first? Is it the magnesium, the posture, the food, or the sleep? And don't forget to subscribe and join this journey of natural healing and healthy aging. Because your body is ready, you just need to give it what it needs. This is healthy aging wisdom, and this is just the beginning.